Doctors of the National Eye Hospital of Sri Lanka initiated a strike action at 8 a.m. today in objection to alleged irregular staff transfers. The Government Medical Officers Association condemned the conduct of the hospital's director with regard to transfers.
A
crisis has arisen due to the arbitrary transfer of staff. We request the Health Ministry to appoint a qualified director to the National Eye Hospital. There is an accepted transfer procedure approved by the Ministry of Health. Let's follow this procedure. If not, it is the patients who will face injustice.
Addressing the accusations, Director of the National Eye Hospital Dr. Jairuan Bandara stated that all transfers have been made pursuant to Health Ministry guidelines.
The approved doctors cadre for the National Eye Hospital is 121. However, we currently have 125 doctors. If I do not release 4 doctors next month, I will not be able to pay their salaries. I transferred 2 doctors in accordance with circulars issued by the ministry to avert this crisis. I have heard that today's strike was launched based on these transfers. Innocent patients sacrifice multiple days of their lives to visit this hospital for treatment. I request that all doctors fulfill their duties to these innocent patients.
Patients were inconvenienced by the strike action, which was launched with no prior warning. Meanwhile, the strike action initiated by the Government Medical Officers Association across the Eastern Province on the 13th of January, demanding the removal of the medical superintendent of the Akarepattu Base Hospital over allegations of misconduct, was called off today. Against this backdrop, the Government Medical Officers Association announced a decision to launch an island-wide token strike at 8 a.m. tomorrow. The association says the decision comes in response to the government's failure to provide solutions to doctors' professional concerns through the budget.
The previous budget failed to provide concrete solutions to issues of doctors, other medical professionals and the hospital system. However, the health minister made some promises in writing in the interest of protecting the free healthcare system. The ministry is, however, postponing the implementation of these agreements day by day. He is now attempting to make a U-turn. We have given him until 7:59 a.m. tomorrow. However, it is evident that neither the health minister nor the government is interested in addressing our concerns. Our executive committee, following extensive discussions, agreed to launch a 48-hour island-wide token strike. Routine medical services will be halted. However, emergency and essential care will continue as usual. The strike will not be effective in children's and maternity hospitals, oncology and nephrology units, military hospitals and the National Institute of Mental Health in Angoda. The government, the health minister and the ministry should bear full responsibility for any and all inconveniences caused to the public.
ඒ සම්පූර්ණ වගකීම මේ ආණ්ඩුව සෞඛ්‍ය අමාත්‍යවරයා සහ සෞඛ්‍ය අමාත්‍යාංශය බාර ගන්න ඕනේ.